Hello, everyone. My name is Cynthia Mejia. I am an associate professor and the interim chair of the Department of Food Service and Lodging Management at Rosen College of Hospitality Management at the University of Central Florida. This is my virtual presentation for the 10th International Conference on Food Studies at Marymount Manhattan College in New York City. My presentation is titled Food and Beverage Produce Supply Chain Disruption Targeting Food Deserts in the United States. And I'd like to first start out by mentioning that this is and was a pre-COVID submission, but like so many other initiatives and processes during this time, this topic has become even more pertinent and has changed since I started this project. And this presentation now is based on a conceptual approach towards solving a problem. And at this time, since COVID had started, no data has been collected. But as this situation is rapidly developing and changing, there are other complexities now that are brought to this issue that I believe are still worth navigating and sharing with the community as the idea is still forming. So let's first start out by asking, what is a food desert? And this is a good question because when we think of a desert, we think of a dry place without any vegetation, although there is some in these pictures. But is it a place without any food? And what do we mean by this term? So we can define a food desert. The idea of a food desert was introduced by British politicians in the 1990s, and slowly this notion has spread throughout the world. And what it's come to mean is that a food desert is not necessarily a place without food, but rather it's a geographical area or neighborhood without nearby access to fresh or whole fruits and vegetables and grains, etc. And also, it's an area whereby the nearest grocery store might be over 1 mile in an urban environment and over 10 miles in a rural area. We typically see food deserts in low income areas where people residing in that region have limited mobility or accessibility to transportation. And in addition, food deserts, they might have fast food restaurants, but these are, this type of food is highly processed. So when we talk about a food desert, we're imagining this picture on the left here, which is fresh fruits and whole fruits and vegetables, and where the picture on the right is all processed and packaged. Residents residing in food deserts have a higher incidence of high blood pressure, diabetes, and obesity than in other geographical areas where people have access to fresh and whole unprocessed foods. So if there is a low income area, say in a city, and fresh and whole foods are farther than a mile away, a corner dollar store or drugstore or other type of fast kind of um, retail outlet or even a gas station might be a place where a person would go, quote, shopping for their groceries. And it will look like this picture on the left. These would be the choices that a person would have. The map on the left is from the USDA Economic Research Service Atlas. It's a food desert locator. And the areas that are shown in this gold or yellow color are the areas in the United States where people have to drive between 1 to 20 miles to access fresh foods. This is 2015 data, and the indicators are from census tracking measures of supermarket accessibility. The nice thing about this map is that you can click down, way down into these areas, and they continue to expand, and you can go all the way down to the street level and see where the food deserts are in your geographical region. If we take a look at the map on the right, this is an example of the proliferation of dollar stores and their popularity and growth. And even before the COVID-19 pandemic in the United States, which really kind of set off all the changes beginning in March, even before then, grocery stores were in decline due to the proliferation of many of these dollar stores. And dollar stores, they sell a pretty wide variety of items, typically around $1. And those items might include cleaning supplies and toys and cosmetics. And dollar stores sell closeout merchandise below the wholesale cost. So that's their business model. In the United States, there are several of these dollar stores that are franchised. Their growth is unprecedented, and as they continue to grow, they will compete and squeeze out full-service grocery stores. This information here is prior to the pandemic. That there's quite a bit of federal funding and local funding to work on this problem. And we saw this and continue to see it too in the form of these different types of initiatives specifically targeting food deserts. For example, there still remain most of these nutrition education programs for children, teenagers, and adults. There are grants available and initiatives to grow gardens in food deserts and bring farmers markets to food deserts, and even bring food trucks that not only cook the food, but they'll sell fresh fruits and vegetables. There are experiential cooking programs for low-income adults. There's a very interesting food literacy project, which is in Louisville, Kentucky, which helps teens understand what fresh food is. So you can imagine if you're a very young child and your family has lived in a food desert for all your life, as you grow and become a teen, if your only experiences shopping for the weekly groceries were at a dollar store or a gas station, then there would be much to learn about whole foods, whole vegetables, and fruits. So there's a lot of work around food literacy. There's the Food Empowerment Project, which is a little bit more broad around the public awareness of the proliferation of the dollar stores. And there is funding, support, and structure for neighborhoods in food deserts that seek to ban or put moratoriums on dollar store growth in the area. So all of these initiatives are ongoing. Some may fade away due to the pandemic, but for the most part, these have been in existence for quite some time. So the question is, have these worked? Has the availability and all of the work on having whole foods and fresh fruits and vegetables, has that helped to alleviate high blood pressure, diabetes, obesity, etc., among low-income people living in food deserts? And the answer is, yes and no. While yes, any efforts towards offering access is an improvement, and there'll be a number of people who will gravitate towards this and see it as valuable. But there's many studies and a body of empirical research that has shown that access to fresh foods does not guarantee that low-income residents will be healthier. And this is actually attributed to uh, an effect as a result of long-term poverty over time. There's this cumulative effect. It's known as a wear and tear on a person. And it's over a time where, a person living under this circumstance is subject to stressors, constant and chronic stressors, which has a compounding effect and damages the body's systems. And this is what, over a long term, results in heart disease, high blood pressure, and diabetes, all that are typically associated with poverty. And there are many other factors now due to COVID, and some of these are exacerbated by the pandemic, but others are innovated as a result of the pandemic. So we've kind of mentioned before those things that are exacerbated by COVID. That has to do with the furloughs and the layoffs. That is, increasing the numbers of people who will be subject to this, and who, if they live in or near food deserts, there will be more, and they'll be, they don't have the money to go and buy all of these things, and they'll gravitate to the dollar stores, and those will continue to proliferate. But there's some interesting innovations around this issue that were more structured and settled before COVID. But I think as time goes on, as things are beginning to settle, will have implications on the during and the after COVID period. And those I'd like to explore with you next. When we think about funding, aside from grant monies and government initiatives, there's another approach to um, food as medicine, or getting food to people in these food deserts. And that can be and has been a medical route. And doctors have been writing prescriptions for a few years now um, for people to eat more fruits and vegetables, whole fruits and vegetables. And this has been in concert with food banks and farmers markets and other outlets. The idea is that either through federal funding or through other insurance channels, that funding model will help to pay for some of this, but feature it as more of a medical approach, a medical mandate. Farmbox.com, and this one is farmboxrx.com. And this company worked, prior to the pandemic, worked with um, produce companies throughout New York, and this company organized excess or secondary types of produce, which is, may have a blemish or may be oddly shaped, and worked with a few produce companies in the city to organize these farm boxes to be delivered to people. And in this case, went the extra step. The woman who owns and runs this company worked with very large insurance providers and doctors to organize a mechanism for distribution. And this is what I would call disruptive distribution, because the idea is that people who live in food deserts, people at the poverty level, they can see a community doctor or be visited by a doctor, or as they get a prescription, the box can be subsidized either through government funding or through grants or through donations and other means. In this case, there's some support through insurance, and they would receive their prescription box, and that way they wouldn't have to leave. They have better access. The box comes to them, and we see this model is really popularized right now during COVID. Grocery stores delivering, the big box grocery stores delivering. There is a brand new industry on delivery to home. So this idea, a little over a year ago, as this idea emerged, it was sort of novel, sort of a new way to think about things. But now, after COVID, this has really taken off. And whereas this was more financially viable at the time, now there's more competition in the marketplace. So to understand the distribution channels is a little bit trickier now, although there are more distribution channels. But navigating all of the process does pose unique challenges that these can be overcome. But like everything during this pandemic, this is going to take a little while. So I want to propose kind of the approach to building a model to understand this phenomenon, which has changed again since I originally submitted this for the conference. And that is that there's the disruption to the produce supply chain, and that the idea was low-income people who are unable to get to a grocery store, they could have fresh fruit and vegetable boxes delivered directly to them, paid through grants, donations, other means, co-opted insurance. And so just want to spend 1 or 2 minutes on a way to think about this. So in the blue on the left-hand side, we have the various distribution channels. And commercially, aside from the back end throughout the supply chain, but this would be called the last mile of the supply chain, which would be at the consumer level. We have distribution in supermarkets and hypermarkets. Hypermarkets include Walmart and Target and Costco, etc., places where not only do you have food, but you also have clothing and automobile stuff and garden center, that kind of thing. We also have drugstores and pharmacies, gas stations, dollar stores. Farm and fleet are similar to farmers markets. They're different types of kind of hardware, ranchy kind of retail outlets. And then we have, of course, restaurants and independent small grocery types of stores. There's food cooperatives. There's online food delivery through apps and meal boxes and urban gardens. And sort of the focus on this presentation were those boxes, the subscription boxes. And then if we look at the top, we can see and kind of color coded what's considered unhealthy foods, loosely defined here as convenient foods or ultra processed foods. The literature presents the titles and the meanings of this type of food in different ways. We go all the way to the right, we see healthy foods, non-convenient, unprocessed foods. And people in food deserts, and people anywhere, in the choice of their diet, they're not going to go from convenient, if their diet's primarily convenient, ultra processed food, just because they receive a box with vegetables and fruits in it doesn't mean they're going to change overnight. So this is a kind of an iterative, a slow approach to educating and pulling people through ultra processed to process to assembling some ingredients to minimally process and hopefully get some people to unprocessed foods. And this takes time.